Right, he's not allergic to nickel or cobalt. He may develop, this is the cross sensitivity. Normally,
Not done. Uh, even if the patch test is not done, you can take just history, clinical history of patient, whether he is having any contact allergy to locally wearing these bengals, because they contains the wristwatches, they contains nickel and cobalt. So only history can reveal the things before putting these stents.
That's a very good input, sir. So, you know, there are stents. There is a stent which contains cobalt chromium. There is a stent which will contain titanium. So, all nitinol-based stents, they are self-expandable stent. So, they contain nickel and titanium. So, for them, we don't have an alternative. But for the heart stent, you know, stents which push it into the heart, they have an alternative. For them, for those patients, we have an alternative. We can use cobalt chromium.
excellent, fantastic knowledge there. So we do have a danger of having contact cross sensitization. Now we invite Dr. Narendra Joshi, who is a senior professor and head department of orthopedics, SMS Medical College. And his main area of interest is arthroplasty, arthroscopy and deformity correction. Dr. Narendra, would you like to tell us what kind of metals you are using in the...
same as Dr. Rao has said, the same combination that most of the time it's stainless steel implants which we are using, and 60 to 70% is contains iron, and rest of the by mineral like nickel, cadmium and molybdenum. And because the stainless steel is commonly used because of the cheaper implants, so most of the time it is the metal implants we are using are made of stainless steel.
Any idea how much of total metal must have been introduced in the people in the population? Just in vague guess, because that question I asked my Dr. Veena Acharya to tell about the copper.
I gave you some statistics. Around there are 20,000 orthopedic surgeons are there. If we think that one implant per day by per surgeon, so it comes around 2 crores implant per year. That is a huge amount. Earlier study shown that the percentage of metal allergy due to implants is 1%. But as its knowledge is grown up, and because of you people, now we come to that point that at the times what we are thinking that it might be infection. It is not the infection. It is the metal allergy which is causing all the problem.
And one more thing which I would like to have a comment on you, that we dermatologists have seen after you are doing total knee replacement, TKR, and the incision of TKR the patient develops a very typical eczema on half of the side of the incision. Can you comment on
Very true, because we have very less knowledge about eczema. We think everything like infection, because infection is very dreaded in implant surgery, like especially in joint replacement. Once it is infected, then it's a disaster. So we were thinking in terms of infection. But what happens? We diagnose it infection by the presence of, is there any discharge or anything we get culture sensitivity done, it comes out to be negative. And we thought probably due to patient is under antibiotic. So there is a sterile fluid is there.
So again, probably the take-home message is the same, that you can also, you are sitting in SMS, and SMS has got a big, huge department of dermatology. You can ask them to do a patch test of that, because that is a good.
Definitely. But nickel, as you know, everybody knows.
Nickel and cobalt, they are the commonest allergens. And the commonest is Parthenium hysterophorus, but after that is the nickel and this thing. And that is what we have included in this today's special day cover also.
One more thing is there, apart from the skin lesions, the aseptic loosening is one of the cause of allergic reaction of these implants. And one more thing, that the skin allergy can be caused by the bone cement, methyl methacrylate. And another is biodegradable implants.
Sorry?
That can also lead to biodegradable implants. Especially in arthroscopy. We use biodegradable screw, and at times after fixation we feel that there is some sterile fluid is coming, or there is a discharge is there, is no bacteria grown. Ultimately we have to remove it.
Great. Thank you very much. Anything else would you like to comment over it?
No, thank you.
Thank you. Thanks a lot. So means cardiologist, ortho.